Good morning, welcome viewers. Today we are here with again another session of a talking thread which we try to entail the important topics of the public interest. Today we have to talk on a very important topic, febrile seizures, with our consultant neonatologist Dr. Deepu Abraham. Dr. Deepu Abraham is a consultant neonatologist and pediatrician who's got more than a decade experience of handling these kind of cases in UK, and now he is presently working with us in Zuleika Hospital, Dubai.
Thank you, Dr. Jaideep.
Doctor, we have divided this talk into two sessions. First, we will just have a common overview of what are the febrile seizures, what are the fits associated with fever, and we will assess what are the risk factors, what kind of age the children are more prone to develop these seizures, and when parents should notice or when parents should seek immediate medical conditions. So what is febrile seizures, doctor?
Febrile seizure is a seizure which a child goes through when there is an episode of fever. It is a relatively common condition. It occurs in around 3 to 5% of children, and it typically occurs in the age group between 6 months and 6 years of age. It usually happens in the first 24 to 48 hours when the child gets a febrile episode. But it is important to note that all fevers with seizures is not a febrile seizure. There could be other causes by which a child can have fever and have seizure at the same time.
Doctor, as you just mentioned that not all febrile seizures are febrile seizures, or not all seizures with fever are not febrile seizures. What are the risk factors, or what a parent should see in in their child, that their child could be having something else, not the simple febrile seizures? So when they should think that no, my child is not having the simple febrile seizures?
For that, first of all, the typical features of a febrile seizure, usually it happens like otherwise well child going through an episode of fever with maybe upper respiratory tract infection, ear infection or something like that, and developing a seizure within the first 24 hours. That is a typical picture of a febrile seizure. But it needs a detailed examination by a pediatrician to find the difference, whether it is a serious underlying infection or not. But the points which the parents could look into is, one is irrespective of the high fever, the child is not very responsive, child is less active, there are rashes on the body which are not blanching. So anything that suggests which is not in the typical picture. But what I would suggest is, it is very difficult for a parent to differentiate between a febrile seizure and some serious underlying infection.
Yeah. So in all cases, you mean to say that parents should immediately seek a medical condition. Doctor, I was just reading that simple febrile seizures, like as you just mentioned, that it occurs in first 24 hours of high grade fever, but it settles within 5 minutes, or it doesn't go beyond 15 minutes, and after that the child is not going to have it again. Apart from this, is there any relevance with the family history of having the febrile seizures, like other children had been having it before, or the first child in the family, or
I mean, all those factors are important. So when you look into the risk factors which say that this child is more likely to have a febrile seizure, one of the most important factors is the family history. That is important when a first degree relative. So for example, if there is an elder sibling in the family who had a febrile seizure, the child is 3 times more at risk of developing a febrile seizure. Similarly, the other things like a child who is prone for very frequent febrile illnesses, he is more prone for a febrile seizure. A child with delayed milestones of development, so there is a background history of delayed development, he is at a higher risk of developing febrile seizure.
What are the common causes, doctor, which you encounter in your daily practice, that a child can have? You just mentioned one, that the respiratory tract infection. Any other reasons or any other causes can also be reason, or any responsible for having the febrile seizures, or any febrile illness can cause this?
Any febrile illness can cause a febrile seizure. But in our clinical practice, we tend to see that some infections, in particular, like ear infections, some particular viral infections like roseola, these conditions are associated more frequently with febrile seizures. But any febrile episode can cause a febrile seizure in a child.
Doctor, we see a lot of parents, when their child get fever, they are going to, just cover the child more instead of reducing the temperature, or they just think that the child is shaking. So instead of bringing the temperature down, they put on more blankets. So what is your take on it? What your message for the parents?
Yeah, I think that's a very important point, because the main reason is parent is failing to understand that the child is having a seizure. So it's important for them to know what exactly to expect in a seizure. The presentation can vary widely, but the most common presentation is that child becomes unresponsive, child becomes rigid for a few seconds, followed by rhythmical, regular, jerky movements of limbs of the body. And along with this, there could be other symptoms as well. Sometimes there will be uprolling of eyeballs, there could be drooling of saliva, there could be fast breathing. In some cases, the child will stop breathing for a few seconds. The color of the child can turn pale, can turn red. So like you said in the introduction, one of the parents in my clinic, she said that when she witnessed her child having a febrile seizure, that was the scariest moment in her life. And I can completely understand that. So the first thing is for the parent to recognize that the child is having a seizure, and then once he recognizes that the child has a seizure, then he or she can take steps to make sure that the child is safe. So the most important thing, I know it is easier said than done, but not to panic.
Exactly.
Make sure that the child is in a safe environment, because the usual complications that we see are not from the seizure, but from the injuries related to the seizure. So make sure that the child is in a safe place, there is nothing there around the child that can cause a bodily injury. If the child is having a vomit, or if having excessive secretions, make sure that the child is on to the side so that she doesn't aspirate these secretions. It is important not to restrict the seizure movements. It is a tendency of parents when the child is having these jerking movements.
Try to hold them.
So it's important not to restrict the movements. Just make sure that the child is safe.
Doctor, what complications have you encountered, in your practice, that the child who presented with the febrile seizures can develop something else, or it can unmask the underlying epilepsy? This simple febrile seizures, we do not know.
I mean, that is the main concern for each parent, whether this febrile seizure is going to be epilepsy. For that, they have done lots of studies, and it is almost categorically proven that a simple febrile seizure is not going to be converted to epilepsy.
So it's a very reassuring sign for a parent that, who are very concerned about the health of the child, that it could be an epilepsy and the child has to take lifelong medications for a long time. This is a good sign then.
Definitely. I mean, when I say simple febrile seizure, it is the one type of febrile seizure which satisfies all the criteria. So that means that the seizure is not very prolonged. So usually the typical febrile seizure lasts for a couple of minutes. The child is normal after the episode. There are no multiple seizures within the first 24 to 48 hours. All these are satisfied.
Yes, that's very good. Doctor, with this we conclude the first session, and we now come to our second session, which entails that how we diagnose a febrile seizure. Either it's just a history-based diagnosis, or we do some further investigations to prove that this is just a simple febrile seizure. So how do you diagnose a case of simple febrile seizure?
Yeah, the diagnosis of a febrile seizure is a purely clinical one. So as a pediatrician, the most important thing for me will be a detailed history from the parent. I'll examine the child in detail and come to a conclusion. But if the child is younger age group, we tend to do blood tests or urine tests to confirm that there is no other serious infection. We don't routinely do imaging scans or brain recording like EEG for a typical febrile seizure.
Okay. How do you treat such cases when you come across the patients in your practice here, or what do you suggest the parents to the mayors which they can take at home to treat the febrile seizures, or they cannot, they should bring the child in the hospital?
The most important message that I would like to give to parents is that you should not treat your child any differently. There should not be any restriction in the child's activities just because he had an episode of febrile seizure. He is just like any other boy or girl of his age. What parent can do is that during any episode when the child is not well, they should make sure that they are monitoring child's temperature. If the temperature is rising, start on paracetamol or fever medications. Use tepid sponging if needed. There is absolutely no role for regular anti-seizure medications in these children because it is proven that it does more harm than good. There is some evidence in the use of 2 to 3 days of anti-seizure medication when a child has a fever episode. So that is completely at the discretion of the pediatrician
who is treating the child.
Yeah.
Doctor, in the end, I would just ask you that is there any way to prevent these kind of episodes or these kind of febrile seizures, because it's very unpredictable and it can only be expected from a child who is having a recurrent febrile seizures.
Yeah, that's right. I mean, 2/3 of these children won't get a second episode. So it's only that 1/3 of kids. Parents should understand that even if they do everything right, even if they do, they monitor the child, they give the treatment at the right time, still the child can have a second episode. It's not their fault. It's just the nature of the illness.
Oh, okay, that's very good, doctor. I think that's very good talk today. And what's your, doctor, take-home message from this all talk? In just few lines, if you summarize all this to a parent who does not know about the febrile seizures, that in few sentences, how will you cover up or how will you sum up all this talk?
I will suggest the foremost thing, not to panic. Make sure that your child is safe during the seizure episode. Don't try to restrict the seizure. Ensure that your child is examined by a pediatrician after the episode, and consider your child no different from any other child of his or her age group. That's all.
Thank you very much, viewers. I think this talk really would help you to understand the importance of febrile seizures, and it will really reassure you that your child is healthy otherwise. This is just a simple febrile seizure, and this is not going to impact or not going to bring any kind of ill impact on his upbringing or his education or his health anymore. Thank you very much. This was our talking thread today. Thank you, Dr. Deepu Abraham, for joining us today.